Good morning, Ruby.
Good morning.
I'm going to see what my video is like here. I don't have good light, but let me check. It's not too bad. Good morning, Vega.
Good morning, Lord. How are you?
Fine, thanks. How are you this morning?
Doing well, doing well.
Good deal. Will be better when Stephanie joins us. She had a power outage moments ago. Whoever is LG Stylo 4, could you identify yourself, please?
Hello, my name is Agne Tigger Revere. I'm with TEC Empowerment.
Very good, thank you. There is Stephanie.
All right.
Particularly interested in seeing Stephanie join us. Good morning, Stephanie.
Good morning, Lloyd. I'm sorry. I'm hoping I can stay on for a bit.
We
I'm
hope so
hoping,
too.
yeah,
Sorry about the power outage. That's
yes,
unfortunate timing.
Hi, Stephanie. Long time no see.
yes. Hey, Helen, how are you?
Good. Good to see you.
Good. Good to see you.
We'll get started probably about 2 after or so.
Okay.
Hoping that Stephanie doesn't lose connection. You're on a mobile hotspot, Stephanie?
Yes, I'm on a mobile hotspot. So that's what I'm saying. I'm hoping I don't. I hope it stays on. We're
Yep.
keeping our fingers and toes crossed.
Yep. Everybody cross your fingers and toes. Morning, Lisa.
Good morning.
Good morning.
Good morning, Manuel. Welcome. Glad to have you with us. Good morning, Megan, Shanta. Good morning, everyone. Anyone else besides our presenter without power this morning?
Good morning, Lloyd.
Good morning, Sharita. Good morning, everyone. I think it's 2 after. We're going to get started in the interest of time and respecting especially people who have joined on time. So we're grateful for that. Thank you for joining the third in our effective case management in the homeless housing system workshop series. Hopefully others will be joining us in the next few minutes as well, but we're going to get started. Our theme today is landlord engagement, and our presenter is no stranger to Durham. Stephanie Williams was a member of the Homeless Services Advisory Committee for several years, representing permanent supportive housing providers, as well as secondarily Alliance Health, Durham Center. Stephanie has worked in the human services field for over 20 years in the Durham County Department of Social Services, the Family Resource Center of Raleigh, the Durham Center / Alliance Health, and she currently is working in the North Carolina Department of Health and Human Services in the Division of Aging and Adult Services, promoting and advancing services and programs and policies that build and support family units and access to affordable housing. She is the Supportive Housing Policy Director at the State Department of Health and Human Services and is responsible for designing and implementing supportive housing initiatives across the department. Stephanie has a Bachelor of Arts in Psychology from that great university in Chapel Hill and a Master of Public Administration from the great Keller Graduate School of Management at DeVry University. And in addition, Stephanie is actively involved with local nonprofit boards, mental health first aid trainings, and the service initiatives of her great sorority, Alpha Kappa Alpha Sorority Incorporated. Stephanie, we're delighted to have you with us. Hopefully you'll be able to stay with us throughout the morning, and we look forward to your presentation. Thank you.
Good morning, everyone. I think I can try to share my screen. As Lloyd mentioned, I just lost power right before this meeting, so I'm working off of a mobile hotspot and hoping that will last. I am excited to be here back in where it all started for me, in Durham County. My first job was in Durham County, and I worked in Durham for most of my career until like 5 years ago when I actually moved to state government. So I'm excited to share information with you and just have a conversation about landlord engagement. So I will get right into it. This will be interactive. There are some activities at the end. I think, is Ruby on? So we can make sure we can do the polling and different
Yes,
things.
I'm here.
Okay,
Yes.
great.
I just said
Thanks.
no.
Okay. So let me share my screen so you guys can see the presentation. And can everyone see this?
Yes, we see it.
All right. So as Lloyd said, I moved into the role of Supportive Housing Policy Director. About 6 months ago, I was the Targeting Program Manager, which I'm sure many of you probably know about that program, and we'll talk a little bit more about it in a few slides down. But this work that I do at the state, of course, works across all 100 counties, trying to make sure that people with disabilities, people that are homeless, people that are very low income, actually access affordable housing within our state. So the populations that you serve are really the populations that I serve as well on the state level. So I know the challenges that are faced in different communities around trying to get landlords to work with individuals that have challenging backgrounds, and the discrimination that sometimes occurs for those individuals. So the first thing I wanted to get into were just some of the barriers so that we can set the process for that, like just to have that framework. So, and I'm trying to work off of my notes and in the dark, and it might not look as dark to you guys, but it actually is dark.
Morning.
For me, I think someone just said something. Good morning. So I got this quote from the National Alliance to End Homelessness. As the gap between increasing housing costs and stagnant incomes widens, the end result is that more people become homeless. And this has been true since the 1970s. So there was plenty of affordable housing that was built in the 1970s. A lot of our project-based rental assistance housings through public housing authorities was built during that time, and was to help low-income households and those individuals that their families, that the husbands were off to war for the Vietnam War, all of those things. But that also meant that when families experience housing crisis, or a family member was out of the home for a while, there was a place for people to go. Unfortunately, in the 80s, the supply decreased. There was increased crime rate due to different social economic strains, as well as an increase in drug activity, those things. And then there was a rise in the cost of living, which put more strain on people to access housing, and especially affordable housing, because as the prices were increasing, our incomes were not increasing. So this really has put a universal strain on a lot of people across the United States. This is not just one particular population, but this impacted a lot of populations. So some other barriers, if we just think about North Carolina, one of the things that we have found is that over 45% of renter households in North Carolina have affordability problems. And some of those problems are influenced by their income level, their household size. I know when I was in Durham, we had a lot of single mothers with 3 or more children. And when you have a larger family size and you're trying to pay rent and feed your family, clothe your family, that you have to make hard choices. What do I pay for now? And then the geographic variations. Working across the state, I have definitely seen that as a challenge for our state in particular. We have a lot of rural communities that don't have a lot of resources. And so what ends up happening is a lot of the individuals that need the assistance can't receive the assistance because they don't have the tax revenue to actually support some of those individuals. Just to paint a clear picture about the barriers for people getting into housing in North Carolina, the fair market rent for a 2-bedroom apartment is $919. And of course, in order for someone to afford this level of rent and utilities without paying more than 30%, because typically we say the rule of thumb is someone would not pay more than 30% of their income on their housing. They must earn $3,063 a month, or $36,751 annually. As we know on this this call, most of the people that we serve do not make this this level of income. Most of them are receiving either SSI or SSDI benefits, and if they're employed, they usually are working at the minimum wage level. So we know that this is really out of reach. And actually this data actually came from the National Low Income Housing Coalition and out of reach data that was out in 2016. So actually it's probably a little bit higher now. The fair market rent is a little bit higher now. And especially in the Raleigh-Durham market, which we have seen increases in our rental rates. So individual barriers, when we get down to the households that we work with, some of the challenges that they face outside of those universal barriers where we just have soaring rental rates and a reduced amount of properties that actually want to rent to low-income individuals. They have credit history issues, criminal history issues, employment income issues. Oftentimes they have poor landlord references because of what has happened within their housing over their lifespan, and then their eviction history. Some people even have a lack of rental history. They may not have ever rented on their own. They might have always had things in someone else's name. And then, like I mentioned earlier, discrimination. There's discrimination, race discrimination, there's household composition discrimination. That's usually seen for families that have teenagers. A lot of people think that teenagers bring a lot of problems, especially teenage boys. So we've seen that a lot of times landlords don't want to rent to families that have that type of household composition. Also, disability discrimination. We see that across the state, and I'm sure Durham is no different, that sometimes as soon as a landlord, property owner, or property manager recognizes that someone has a specific disability, and we see it quite a bit with individuals that live with mental illness or substance use, they do not want to rent to them if that is ever revealed to the landlord. And then application and credit check fees. If people's income is already tight, it's hard for them to pay multiple application fees to different property management groups. And then lack of move-in funds. Even when people do have access to housing, oftentimes they don't have the ability to afford the things that they need in their homes. And we all know that this occurs. And I've always been big on, you don't put someone in an empty apartment. You don't put them in without linens and pots and pans. So when we think about all of these challenges, and I'm sorry if you hear background noise of airplanes, I actually am in my hometown today, and I am adjacent to Seymour Johnson Air Force Base, and they're doing exercises. So when you think about all of the challenges that the individual faces, of course, the landlord has concerns about these things that a household may be experiencing. And for a landlord, it's basically dollars and cents. They want to make sure that they are paid on time for rent, and they want to make sure that the person is taking care of their property. So even if it's just a perceived risk, landlords have great concern when they are renting to the homeless population, people with low incomes, because they have this preconceived idea that individuals that are homeless or have low incomes are not going to take care of their property, or they are not going to pay their rent or be respectful to their neighbors, or they're going to see themselves with high turnover. So those are like big concerns for most of our landlords, most of our property owners and developers. So when we think about just staying on that for a little while, if you are presenting to a landlord and you know that someone has a lot of these barriers, and you know that this may be a concern for these landlords, you really have to think about, how am I going to move forward with selling this family or this household to this landlord, and that they would be open to working with my agency, with this particular household, or other households like this household. So when we think about strategies to access private and public market housing, the things that I take away are tailored marketing to landlords. Every landlord is different. You have your large developers that own multiple properties, and large community properties, or you have your mom and pops, which your mom and pop shops usually are more lenient, but they get burned too, and after burnout, you have a harder time working with them as well. Other strategies I want to talk about is emphasizing your program benefits. What makes your program stand out versus another program? And then talking about being creative in your advocacy approaches. Sometimes we get stuck in using the same approaches, and sometimes we got to think outside of the box for how we may approach a property manager. And then I want to talk a little bit about landlord incentives, risk mitigations, those tools that you can use, and these could be financial or non-financial tools that you can use to try to engage landlords that have been hesitant about working with you in the past. So some of the tailored marketing strategies that people can use is using their agency annual report, listing your donors, because that shows that those donors believe in your work. And if the landlords can see that, I don't know, Home Depot is backing you and supports your organization, even if it's in-kind donations, they are more willing to say, well, maybe this is a reputable organization, and I can give them a chance, because that means that they actually follow through on what they say they're going to do. Other things to market to landlords is your program brochure, a packet of information. And these things you usually need to go and try to have a face-to-face meeting with the landlords, or you can do it in where we have down a landlord breakfast or luncheon, where you make a general presentation to multiple landlords at one time. The other marketing that you can do is social media, posting your success stories on social media and tagging those landlords or property owners or developers that have worked with you, and then stream those like media coverage. If you are receiving some type of award from the city, the county, invite WTVD 11 to that event, so that you can get that media coverage. And once the landlord hears your organization's name, they can remember, hey, I saw this on WTVD, WRAL, and I am, willing to actually work with this this agency. And then landlord breakfasts and luncheons. This has been a great marketing tool for a lot of the agencies. I know a lot of the agencies in Durham actually do this. I've attended some of these breakfasts and luncheons in the past, especially when I worked in Durham County, and to have people tell their story, as well as having those landlords give their firsthand experience of working with your program, is definitely a selling tool to other landlords. And if you have a way of sitting your existing landlord pool with new landlords, the ones that you want to attract, at the same table, that is a great marketing tool, because as they're sitting there talking, those landlords can tell their stories, and actually have the time that you spotlight different landlords in your presentation, so that people really understand that you didn't pay the landlord to say anything. It's just their true experience. And then customized housing locator partnerships. And this is probably more of a community-wide marketing tool. I'm sure most of you have heard of Social Serve or nchousingsearch.org. And with that, that housing locator tool, landlords and developers, property managers can actually put their, market their vacant units on that platform for free. And typically what happens is a city or county, and the state currently has a contract with nchousingsearch.org or Social Serve, so that any property that works closely with the state is usually the low-income housing tax credit properties. They actually can advertise their properties, and they actually get more people to show interest in their properties, because that tool allows people to go in, choose the amount of rent they can pay, what are the accessibility features of a unit, and it then shows them what units are a good match for them. And for agencies, the good thing is there's a case management function where you can go in and target specific areas and say, if you're having an issue with locating housing, in that case management function, you can go in and say, I'm just going to use this as example, Bahama. I have been unable to find housing in Bahama, North Carolina. Then Social Serve will actually go and try to locate landlords in that area, so that they can market to that specific group that you're working with, and try to make those connections on your behalf to work with some of these landlords. So that is a great tool, and it could be something that the city or county of Durham, might want to partner on and help landlords in in Durham County actually advertise their units with that tool. So the next thing is what are your program selling points? There are some questions that I think that you need to ask yourself before you even present to landlords at a luncheon, or if you're having a face-to-face meeting. Oh, my lights just came back on. One of those things is, do program participants receive tenant and financial education? I know one of the big certification programs is Ready to Rent. Do you have your participants go through something like that, a certification that you can show to landlords that this person is serious about paying their rent on time? They are trying to gain the skills to be a good tenant, because those things are covered in those type programs, and they received a certification. And then how does your program provide in-home services? Do you actually provide in-home services once a month? Do you do it quarterly? Because, you know, most landlords, they are concerned about their property. Is there going to be damage? And they know that you're basically their eyes and ears for their property, so that if something is wrong, they can go ahead and take care of those maintenance issues instead of it becoming a bigger problem. Does the program provide client landlord mediation if problems arise? And so oftentimes, if you have meetings, they want to know that they can call you, that they can meet with you, that there is a single point of contact at your agency, that if there's a problem with a tenant, there's somebody that they can call. They can have a meeting between the tenant and the landlord, as well as that service provider, and you can address the issues, and there may be some time frame set up for that. And then how does your program differ from other housing programs? I don't know if anyone from Durham Housing Authority is on, and I know they can speak to the challenges that, you know, the different housing authorities have had with landlords. Oftentimes, what we hear from a lot of our landlords is, I don't want another Section 8 program because they pay me late. Or I have to do all these inspections. And, you know, a lot of the housing authorities have tried to work and put in other incentives and you know, shown their success with landlords to try to reverse that thought process of a lot of landlords. But if you can say, we pay on a weekly basis, we cut checks weekly, so we know that our payments are never late. If we do miss a payment, we know that it would be in the next round of payments. And then your success history showing that by the 5th of each month, we've mailed out 99% of our payments. And then what sort of productive activities participants involved in or they're already doing? Do they go to school, or do they have a job? I know with the programs that the state administers, that is one of the key questions that comes up is, you know, does this person have something to do during the day? Because what we have found is when people don't have anything to do, and I quote my grandmother on this, it is an idle mind is a devil's workshop. And it's so true, because people sit there and they're thinking about, well, I don't have anything to do. So they start doing things that they may not see as a problem, but other people see as a problem. And what we have seen, especially during this pandemic, are people are going to other people's homes because they're lonely. And other tenants do not want the visitation. But because a lot of the individuals that we work with in the state programs are coming out of institutional settings, they are used to having group activities and being around a lot of people. And in the homeless community, it's the same thing. You know, you have your homeless camps, that's a community, it's their family. And for you to have to sit in your apartment alone, that is very hard. But what we have found is that people, when they don't have any activities outside of the home, they actually start ending up with harassment charges. There's a problem for the property manager, the on-site property manager, because they're going in and out of their offices and they get upset when they cannot have that interaction. The other question you want to ask yourself, what financial support exists for families? Does your program assist with the rent? Does the family only pay, 30% of their income towards the rent, and your program pays the remaining part of the rent? Or do you pay security deposits? Do you pay for property damage? And then, like I mentioned earlier, what is your turnaround for financial or reimbursement of payments? So we talked about a few things that you can do to sell to or market to the landlord. And now I want to talk a little bit about what are the strategies that you have used for individual barriers? So Ruby, if you could pull up the poll, this is a time for you guys to be a little interactive. I want to see what people have tried. So if people could respond to this question.
Ruby, could you confirm, can people choose more than one of these? Or is it only one?
You can choose more than one. I just did it.
Okay. Ruby, do we have results?
I have 62% participation.
Okay.
Right now, character and advocacy letters is leading at 74%.
Okay.
Can you all see the percentages?
No, I don't see them. And it might be because I'm sharing my screen versus you sharing your screen. It might be that.
Okay. I'm going to close polling in 4, 3, 2, 1, 0. And share results.
Okay. So
Very good,
we
we
have a
can see
lot
them.
of people using character advocacy letters. Okay. Thank you, Ruby.
Welcome.
So, and that is a very good tool to use when you are trying to not just sell the entire program, but you are trying to get an individual that may have lackluster credit, criminal history, or just housing history in general, how you get them into housing. And those character advocacy letters are usually letters that are written on behalf of the person, just describing what changes they've made. It could be, if they have a criminal history, it could be from a probation officer showing that the person has made great strides. They are always on time for their appointments. They've never missed a probation appointment, which will indicate that the person is responsible. So those things go a long way. If you have letters from a religious organization or from a medical provider, and of course, and then from your agency, what have you seen as strong skills that this person possesses? So those letters speak to what that person is capable of doing, even though on paper it may not look like that person is capable of taking care of their household because of their criminal history or because of their credit history. It doesn't look like they're going to be responsible. As I mentioned earlier, the certified tenant education programs like Ready to Rent, those programs, when landlords see that someone has gone through those classes, they know that that person is serious about trying to learn the skills needed to be successful in housing. They want to do things differently, and that certification can go a long way. And that could also be a community-wide initiative where the city or county backs that to say, this is a certification for all of the individuals that we serve through Durham COC, that they go through this program and we know that they have learned the skills needed to be successful in housing. And that probably goes a long way for landlords, for the city and county to come out to say, this is something that we are behind, and we support agencies, our homeless agencies, to utilize this particular program. Are there specific programs that some of the agencies use outside of Ready to Rent? And I guess you can either put that in the chat, or I'm not sure I can see the chat, or if Ruby, if you have to take them off of mute.
Folks can unmute themselves.
Okay. Have people used other education programs besides Ready to Rent?
Stephanie, I've heard that some organizations at least have modified the kind of nationally certified ready-to-rent program, maybe abbreviating it or adding some things to it, but not necessarily using the complete certification program. Did
Okay.
have one question in the chat since I have your attention. Someone was asking whether anyone would be willing to share a landlord-tenant program communication agreement. And I don't know if you have one that you could share as an example that we could get out to the participants of that.
Yes, I think I do have one. Just to go ahead and speak on that, usually the landlord-tenant program communication agreement is basically an agreement that describes how the agency will communicate with the landlord. If we'll do weekly check-ins or monthly check-ins directly with the landlord, and we will also include the tenant on those in those meetings, so that you can address things as quickly as possible. And really that goes a long way with landlords, because that once again tells them up front what your commitment is to this tenant and what the tenant's commitment is, to make sure that they are being a good tenant. So I can send a copy of an agreement that is in place, but this tool has seemed to work, and I'm trying to find my notes to see where agencies have used this tool in the past. And I may have to just send that along with the example that I have.
Hi,
Very
Stephanie,
good.
it's Sharita.
Hey, Sharita.
So I normally use that as part of my advocacy letter. So I usually make that commitment as part of that. I don't have a separate formal document. But normally I use it in my spiel when I'm trying to get a landlord to work with one of my clients.
And that you can use it in that manner too. I think the communication agreement, the reason it's different is because all three parties are signing it. The advocacy letter, typically it's one person's signature, but with these, it's everybody has agreed to that. So that's probably the biggest difference. Lloyd, were you going to say something?
I was going to come back to the tenant education program and just invite you to comment perhaps on the importance, I think, of offering tenant education for formerly homeless people after people have been relocated into housing. With housing
I missed
first.
the last part of your
Yeah,
question,
sorry, I'm
Lloyd.
playing with my mute system. So the idea is that with housing first approaches, we would want to offer tenant education after we've already relocated people into housing, and not make completion of any kind of tenant education program a condition of getting into housing or offering people assistance to find permanent housing. But certainly important to offer tenant education to tenants, and that can be a selling point with landlords.
Yes, and thanks for bringing that up, Lloyd. Yes, we don't want to create other barriers for individuals, like putting parameters on when they have to complete something prior to housing, just like we don't with housing first. And I know Durham is a housing first community, you don't want to put those type of stipulations on a tenant, but if they do have it prior to, or applicant prior to moving in, it's a selling point, but it can be a selling point afterwards. If it's something that they do after they have moved in, because once again, it's showing their commitment to improve their skills. Reasonable accommodation request. That is so important for individuals with disabilities. If someone is denied housing, we don't want to just walk away and not try to advocate for that individual. If there is a way that you can connect the dots between that person's disability and their behavior, that criminal activity, their activity with being evicted, any of that, I would say that goes a long way. We've seen where reasonable accommodation requests actually have turned around denials. One example that I would give is with a public housing authority. And it's not Durham Public Housing Authority. I chose someone outside of Durham. But what occurred, the person, the head of household has a mental illness. Their child actually has an intellectual and developmental disability. They live in a rural community within the state, and they were having to travel quite a ways to get to the services that they needed. And because they had just received their approval for Section 8, most public housing authorities have this rule that you must stay within that jurisdiction the first year of housing, that first year of receiving that Section 8 voucher. And this family, mom trying to do what she needed to do to make sure that she was taking care of her mental health and making sure that her child received the necessary services that she needed as well. She was driving back and forth to different appointments. Well, because the housing authority was not allowing her to move, she actually left her housing. She left without really any notification, and basically she gave up her voucher because she wanted to be closer to her services. So when we were made aware of this situation, we actually worked with that LME MCO to write a letter back to that public housing authority to ask for a reasonable accommodation for that individual based on her disability, because she was actually being denied access to another public housing authority, because she left another housing authority and owed them money, and she did not leave in good standing. And so when that request was written, it was overturned, and she was able to regain Section 8 voucher and move into housing that was closer to her provider. So we have seen that work. As long as you can connect the dots, it does work when someone has been denied for housing, and they're being denied for specific reasons. I would encourage that you actually get written denial letters so that you can see clearly what the person is being denied for. There is different rules of thought about, do you write the reasonable accommodation letter prior to the person going into housing, or do you write it after the denial? And that is the person's choice. They may want to be upfront and say, yes, I have a criminal history and I have done A, B, C, and D to addressed those issues, and now I'm doing much better. I've completed my probation. I have been involved in some kind of case management services. I'm doing these things. They may want to put that out there before they even apply for housing. And then the last thing that we have here is lease addendums. This usually is something that occurs for larger developers. Usually those are cookie cutter type processes that large developments have. And what we have done in a lot of our state programs is added like these lease addendums. And this has occurred in a lot of different areas. And I'm looking back in my notes now to see outside of the state of North Carolina, there are other states that have tried this as well. But what happens is you write an addendum to the lease that says what the agency is responsible for doing, what the steps are that they can take to evict the person if the state or a particular agency doesn't take these steps. Typically in our lease addendum, and I'll say the key lease addendum, it says what the state of North Carolina or NCA, North Carolina Housing Finance Agency, will do on behalf of the tenant. That means that we'll pay the rent by the 5th of each month. We'll pay a security deposit. We will also cover damages to the properties, but these things will only occur if if it's reported to the state that security deposit was not received, or the damages to the property were reported in a timely manner. We have like time frames on that, and the property and the tenant have to sign that lease addendum. So that works with larger properties. Usually mom and pop agencies don't usually get into that, but we have done that with larger entities because, like I said, usually those are cookie cutter lease agreements, and they don't try to think outside of the box. So it was a way for the state to try to help them think a little bit further outside of the box with serving some of the more challenging populations. So that's something else that you can ask, that there is an additional addendum, especially if you are paying a portion of the rent or paying security deposits or paying any of the things that we'll talk about in the next few minutes around incentives or risk mitigation funds. Are there any questions so far? And I can't see the chat, so if there are questions, I think Ruby and Lloyd, you'll have to let me know.
Manuel added that referring agency should initiate and sustain tenancy support, frequent and ongoing contact and assessment connecting the household to resources, as well as develop and make and sustain relationship with the landlord.
And was that a question? He was telling us that was a comment.
Oh, just a comment.
Okay. I just wanted to make sure that it wasn't a question for me. Yes, those are.
And if you agree, and your agreement with that.
Yes. Because I think, Manuel, you were the Lions, right? Are you the?
Yes.
Yes, okay. I just want to make sure I was thinking of the right person. Yes, and I know that you guys have some kind of, checklist that you have providers do to make sure that there is engagement with tenants at different properties. And I think that does go a long way with landlords. Not that you show them all the documentation, but at least letting them know that there are things that you review with a tenant each time that you make a visit. Okay, so I think I have something backwards here. Landlord incentives. So the other thing that you have to, have to be able to do to try to, get landlords to buy into your program are some incentives or what I call risk mitigation tools or funds. And all of these things, I'm not saying that all of these things will work necessarily for you in your program, but these tools have been tried in different areas across the country, and they actually have worked to get landlords to engage with harder to serve populations. So one of the first things is master leasing or co-leasing. How many people have actually heard of this? And is there anyone in Durham doing this? Not everybody speak at once. Okay, so I guess the silence is telling me that it may be something that you guys are not actually practicing right now.
Mine was on mute, but community empowerment, they do the landlord incentive.
I can't hear who's speaking right now.
Community empowerment does a landlord incentive.
I think I heard community empowerment
Yes,
does this.
yes, they do.
Okay,
Okay.
well, great. So I am glad to hear that there are entities in Durham doing this. So master leasing is one strategy that has been used in different communities, and it's in basically when a third party, and it's usually a government entity or a larger like nonprofit service provider, leases units, and they may lease a block of units in an apartment community as a way to gain access for their tenants, instead of the tenant actually having applying directly with the apartment community. The tenant is actually have a sublease with that government entity or that nonprofit entity. And so it, to the landlord, it appears less risky. They're not taking as much of a risk, because if there is a default on payment, they're going to go after, of course, that government entity or that nonprofit entity. And most of the times, we all know that if a government agency or your nonprofit agency defaults, that is bad press for your agency, and that can spread like wildfire. So that's not going to happen most of the time, and most agencies are going to follow through with what they said they were going to do. And for a landlord, it's just less of a risk. They don't see that as a lot of turnover. It also is a way for them to know that 10 of their units will always be paid for, because you typically, when you do master leasing, you go ahead and you pay the rent on those units regardless if somebody is within the unit. So for them, they know it's guaranteed funding. So some examples of people doing master leasing: the San Francisco Department of Public Health Direct Access to Housing Program. They've done master leasing. So I don't know if Sharita, and I don't know if somebody else, I think Helen was on the call, that's in the health field. That may be something that you might want to partner on to actually help individuals that are coming out of the hospital and helping them with housing and doing a master leasing program. The other benefit, and Alliance didn't speak up. Manuel, are you the only person from Alliance on the call?
No.
Hey, Stephanie, this is
You said
Malcolm.
no? Malcolm. So Malcolm, and I don't want to, since I just wanted to make sure I didn't speak on Alliance's behalf, but you guys have done master leasing.
Good morning. This is Tracy as well. I'm online as well.
Okay. Hey, Tracy. Do you want to speak to that, Malcolm, Tracy?
Of master leasing with our bridge housing program, with TCLI. We've partnered with other local government entities to do that. And it's been successful because it's almost a hybrid of a transitional housing solution as well as a shelter for individuals who are transitioning from either an emergency shelter, hospital, or institution. I apologize for my dog in the background. But yes, we have, and just recently during the pandemic, we've also been established one in Durham.
Right. And do you still have the relationship with Maplewood in Durham? I know you
Yes,
had
but
one
that's
in Raleigh.
Go ahead, Malcolm.
yes, we do have the relationship with Maplewood, but that's not master leasing.
Master leasing.
We provided funding for purchase, so we have right of first access to some units, but not master leasing.
Not master lease. Okay. So I wasn't sure if that was the problem, if y'all had that here in Durham. Okay, well, thanks. I didn't want to speak on your behalf, but I knew that you had done that with your bridge housing programs. So just wanted to show that it can be done in the Durham community, and encourage you to talk with Alliance about how they did that and the effectiveness of doing that with landlords. Protective payee programs. This is something that actually was new to me until, in recent times. And this is not to be confused with your individual payee programs, but the protective payee programs are actually set aside funds where the individual actually sets aside a certain amount of money each month to the program, and the program holds it in a trust. And on that person's behalf, they pay their rent each month. And so that way, the landlord knows that they're going to get payment because that person is coming from the agency, but that person has made an agreement with their agency that there is their funds, but the agency is going to pay those funds on their behalf each month, so that there is no risk of the rent not being paid. And so this has been effective actually in California and one other place, and I'm looking in my notes. I want to say it was effective in Ohio. That there are a couple of programs that they have used this strategy, and usually this occurs with people with substance use history, so that's a way for them to build trust with the agency, as well as building trust with that landlord. Rent guarantees, that's another thing that a lot of agencies have done. They guarantee that the rent will be paid, and that's basically saying to the landlord each month, our agency, the tenant is responsible for 20, 25, 30% of the rent, and the agency is responsible for the other portion, and we guarantee that we will have these funds available to pay you for a certain length of time. If you have a grant and you're going to say, we only do this for 1 year, 2 years, 3 years, you put that in that guarantee. But if this is something that is long-term payments, you explain that to the landlord or property manager as well.
Hey, Stephanie, this is Malcolm.
Another,
A quick question.
yes. Uh-huh.
Would you mind sending or including at the end of this the example that you have for protective payee programs? I'm curious about that in terms of whether those accounts get held, whether those funds get held in like an individual trust accounts per each tenant, or if they pool that. I'm just curious about how that goes, because it's been a couple of cases where I think that can be beneficial, but it doesn't feel like it's happening at the MCO level yet.
Okay. Yep, I will send that information.
Thanks.
Make myself a note. Oops, sorry about that. Advance and vacancy payments is another incentive to landlords. That is something that a lot of government entities have done. The state of North Carolina actually provides this incentive where we call it hold payments versus advance payments, but we will pay up to 3 months if a person has been approved for housing, but for whatever reason, the person, goes into the hospital, or the person actually has a short-term stay in jail for maybe some non-violent offense, and we know they're coming back to their, they can move into the unit in that period of time, we actually will pay to hold that unit so that that person can go into housing right after they are released from those situations. Also, there are vacancy payments. If a unit is sitting vacant because a person, they're already residing within a unit and they have to go, go into the hospital, or we've had situations where people have their family lives outside of this country and it doesn't make sense for them to go visit, for 1 week. It's just too costly for them to visit 1 week. We've paid for people to be gone to reunite with their family because of the loss of mother or father, for them to be gone for 2 months, but that's a vacancy payment because we know that the person is not in the unit. We've also had vacancy payments with our integrated supportive housing program in the state, and I'll talk a little bit more about that in a few minutes, where there's an agreement between the property developer, North Carolina Housing Finance Agency, Department of Health and Human Services, and the LME MCOs, that we're saying we're going to fill 10 of your units with an individual that is in the Transition to Community Living Initiative. And if those units are not filled in a certain amount of time, we can do a vacancy payment so that we can continue to have that unit. And it's an incentive to the landlord that they are collecting some rent on that unit. The next thing is increased security deposits. Typically, you may pay 2 times the rent for a security deposit, but that is an incentive to landlords, especially if you don't have the next thing, the wear and tear guarantees or agreements, because if there's damages to the unit, that security deposit can help cover some of those costs so they can turn the unit a little quicker and get someone back into housing. And then wear and tear guarantees, that really speaks to if there is property damage to a unit, that you have a certain amount of funds set aside to pay your property managers or landlords a certain amount of funds to cover damages to a unit. It's usually the damages that are not covered, that are outside of the coverage of their insurance claims or it's the deductible amount. Now we may not pay, most agencies can't pay you know, all of the costs, so you do have to establish a cap. The state has a cap of $2,500 for damages. Now, of course, sometimes we will do waivers so that we can protect the relationship with the landlord, especially if we have some serious damages to a unit and it's very costly. We have waived that amount and gone a little higher so that we can continue that relationship with that property management company or landlord. And then eviction agreements, those are agreements that you as an agency will pay for the eviction costs associated with a tenant. And that again is an incentive for landlords. Most of the times landlords don't want to go through the eviction process. I mean, it becomes quite costly for them. And a lot of times they do everything they can to not evict the individual, and oftentimes we try to do a mutual agreement for the person to leave before eviction even occurs. And I encourage people to do that because that avoids an eviction being on someone's record if they actually do a mutual agreement to leave at a certain point during their tenancy, and especially if things are not going well for that individual. Are there any questions about landlord incentives? So, as I was talking through, I have mentioned some of these existing resources in North Carolina that actually have utilized some of these strategies I've talked about. And these programs are open to the homeless population. Of course, there are some requirements, some disability requirements for each of these programs, but a lot of you I know have utilized some of these programs that's through the state, and we have really worked hard at the Department of Health and Human Services to develop some policies and programmatic features that really addresses individual barriers, system barriers, so that people can access housing more quickly and they are not let down at the point that they start going through the application process. And so I'm just going to talk a little bit about these programs, and then we're going to do a little exercise. So the targeting program, I'm sure most of you have heard of the targeting program. And that program is our largest state affordable housing program. This is a partnership between North Carolina Housing Finance Agency and the Department of Health and Human Services, where through a qualified allocation plan, and each year, anyone that develops affordable housing using low-income housing tax credits, they must set aside at least 10% of those units for individuals with disabilities. And so with the targeting program, it is disability neutral. So if a person has a physical, mental disability, they are able to gain access to these units. We have asked landlords to go up to 20%, and this is where we do have incentives. If they go up 20%, we actually increase their rental rate, the payment standard for that particular landlord, or that property management company, if they choose to go up to 20% at their particular properties. And the way that these units are made affordable is through the key rental assistance that is appropriated each year by the state of North Carolina. Right now, I'm sure people have heard, we have had some restrictions with the program because the state has not increased that appropriation over the last 10 years. And we, like I said in the beginning, the housing rental rates have increased. And so we've had to scale back on who can actually apply for targeted units that receive key rental assistance, so that we can make sure that we can serve the most vulnerable populations. And the homeless population is included in those preferences. So right now, this program focuses on preferences given to people within the Transition to Community Living Initiative. Money follows the person, and then the homeless population. Other populations can receive access to targeted units, but we actually try to steer them to the units that actually have project-based rental assistance. So there are targeted units that actually have been set aside, and the property actually has some federal rental assistance that we can use instead of the state rental assistance. So we really have tried to work with other populations with that. But our primary focus now are those three population groups. But of course, the first priority goes to the Transition to Community Living Initiative participants, and we'll talk about that in just a minute. But this program has been around since 2002. It has shown to be very effective in our communities. It's actually very affordable for individuals. They pay 20 to 25% of their income towards the rent, and the state pays the other portion of the rent. And that is a benefit to that person when they are only having to pay a small amount of their rent towards, a small amount of rent, so that they can take care of the other things within their household. One of the things for this program is that the person does have to be referred by an approved referral agency. So the way to become an approved referral agency is for you to go through a specialized training with the Department of Health and Human Services to be a referral agency. One of the things that is required of that agency is that you do provide the necessary supports, so the person has access to the necessary supports needed should they need those supports in housing. And those are things like if they have issues with housekeeping, budgeting, those things. We do want agencies to work with the individuals so that they can get back on track to maintain their housing. So there is an agreement that the agencies do have to sign to make sure that you're following through on that. And I know that quite a few people on this call are approved referral agencies. The next program is the Transition to Community Living voucher program. And this program was developed in response to the North Carolina settlement agreement with the Department of Justice back in 2011. And it is really to provide integrated housing along with services for individuals that have a severe and persistent mental illness or serious mental illness that are transitioning from adult care homes, state hospitals, or they're being diverted from adult care homes, or they are at risk of moving into an adult care home. So in order for those individuals to get into housing, we developed the Transition to Community Living voucher program, which works very similar to Section 8. It is tenant-based rental assistance where the person can choose any housing option within their community of choice, and the state pays a portion of their rent. They, again, pay 25% of their income towards rent. and the state pays the remaining amount of rent. The rent is based on a fair market rate. We do allow, because in some of our counties and urban areas, of course, we can't get units at, if it's fair market is $1,000. We all know in Durham it's kind of hard to get a unit at that price now. For like a 2-bedroom unit. So we will go above the fair market rate, but of course there has to be an approval, and we have to make sure that the individual, that there have been other options presented to the individual. The good thing about this program is the same like with the targeting program. The security deposit is paid for this individual. They also damages are paid if there's damages to the unit. Eviction costs, if there's eviction, if the person is evicted, there is a coverage of eviction costs. And I'm probably forgetting something, but it basically covers anything that's like a cost to the landlord that would be a reason for that landlord not to accept that person. If they see it as a risk, we are actually paying them to take that risk, because we're saying we're going to pay your security deposit. We're going to pay for any damages that occur. And this person is going to have these follow along services while they are within your property. Now, as we all know, things are not 100% great all the time, but I will say with the targeting program and the transition to community living program, people have been very successful in those programs. And of course, it's that 10% that people hold on to as landlords and property managers, that they're saying, oh, I don't want to work with this population. And it's the same thing that occurs with the homeless population. You have a few bad apples and they say, I don't want to work with them. So that is why the state invested so much money into the risk mitigation tools, so that we could actually incentivize landlords and convince them that we do need housing for individuals that may be considered harder to serve, but we want them to have access to decent, safe, and affordable housing, just like anyone else. And we are going to be there with you to walk through this process. And we are actually giving you some incentives to actually be a landlord with these programs. The last program, which is a bit newer to the state, is the Integrated Supportive Housing Program. And this program actually is again a partnership with North Carolina Housing Finance Agency, DHHS, and the LMCOs. And so there is a NOFA that is put out every few years. We're working on one right now for a developer to develop a property within an identified region in the state where we're saying there's not enough affordable housing. We need someone to develop affordable housing. And we are asking them to set aside at least 20% of their units for development or rehab of a property. And if they do that, then there is gap funding for their project. If that property, say they've had all these different funding sources, they were getting some federal home money, they may be getting CDBG money, just different streams of funds. The state has set aside money to say, we will be a stopgap, like whatever you are, the funding you don't have available to finish your project, we are going to invest in this project as long as you set aside 20% of your units for the population that is identified, which right now it's the transition to community living initiative population. But we know that at the end of this settlement, we are probably going to branch into more Olmsted populations to make sure that we're continuing to serve individuals in those areas that we know housing is definitely needed. And so we've had to try to spread the wealth across the state. We all know that we don't have an endless pot of money to develop these properties, but I will say there are properties in Durham County that exist through this process. Vermilion is one of those properties, and the person does have to go through Alliance to be referred for this particular program. You cannot do a self-referral. It has to come through Alliance in order for someone to access the units at the properties we're working with.
Here. These are giggly.
So I have a ton of questions in the chat box.
Okay. In the chat? Okay, I'll get to them. I can't see them.
You probably won't be able to answer all of them because it's too many questions.
Okay.
You might not be able to answer them on the call, and I don't want to bombard all the time. But specifically, this program has the Integrated Supportive Housing Program has the intrigue.
It has what? I'm sorry.
Somebody
I didn't hear you.
Can you hear me?
I can hear you now, Sharita.
But I thought somebody else was saying something, so I stopped.
Yeah, somebody did say something, but then they stopped.
So the Integrated Supportive Housing Program, it has me intrigued, and then I remember when Vermilion was supposed to be another property through targeted housing that we're going to be able to use, and then something happened and it changed, and they told us it was no longer an option. So it's good to hear that Vermilion, there is a way to access those resources. My question is, so I have two questions, and this might be a Tracy, Malcolm, Manuel question as well. How do we get, when our clients have these services, how do we get the providers to actually apply for these programs instead of sticking people in rooming houses and things like that? So that's the first question. And then the second question is, if our client does not have an enhanced service, but they have a disabling condition, a mental health diagnosis, but they don't have the enhanced services. And this happens a lot to our folks in the homeless community because they don't have Medicaid and they're waiting on wait lists sometimes, right?
Mm-hmm.
How do we help our clients get identified for these type of services and have somebody who they can go to within Alliance, because they say they just have the basic service, which is they have psychiatry, med management. Mm-hmm. How do we get them access to this program? Because that's frustrating for somebody like me to know that it exists and know that my client can access it. I can't get them to it, and they don't have a provider to get them to it. So what do we do? Because this is a barrier to accessing resources that our folks qualify for. How do we accommodate when we know systemically, this is an issue for a lot of folks that we serve in the homeless community?
So I will let Alliance answer in just a minute, but what I want to be clear about right now, the Integrated Supportive Housing Program, they have to qualify for TCLI.
Oh.
And then, they have to qualify for TCLI. And so if that person does not meet the criteria for TCLI, that is something that I don't think Tracy, Manuel, or Malcolm would be able to necessarily speak to. You would have to talk to the staff at Alliance about the TCLI qualifications. But I may be wrong, Manuel, Tracy, or Malcolm.
And you may be right. So then I have another question, because the other thing that happens to us is that we get a ton of people in Durham that come from somewhere else. And ironically, sometimes we find out that they had a TCLI referral in their county of origin. Now they're in Durham County. technically they don't have a TCLI referral because it didn't come from this, the referral didn't originate in this catchment area. And that's one of the questions in my series of questions. How do, has the state been looking at changing the policy around TCLI referrals as far as folks kind of crossing county lines, MCO, LME lines, and how we continue to make that person eligible so that we can serve them in our community once they get here? Is that something that's being looked at? Is that something that's been accommodated, being that we're in COVID pandemic times? Can you just kind of speak a little bit to that?
Yes, so individuals, if they cross county lines, the LME MCOs actually do work together to try to transition that person to the county in which they have moved to, so that they can move all of their services and support over to that new LME MCO, get the Medicaid transition and all of that. I think the issue becomes, and I know we've just went through this recently and not in Alliance's catchment area, but a person moved and they didn't notify their they didn't notify their transition coordinator.
Well, I had two.
They only found out afterwards. And so then they had to backtrack to get all this work done. And so that's, if you have people,
I had two people who the MCO actually is the one that moved them from their county to our county because we had better resources. But they did not contact Alliance to say, hey, our guy who we already did a TCLI referral, it's coming to your county. We need you to, we need to establish the care coordination, on this side to kind of try to catch that person so that that person can access, all the resources and the services they're entitled to. And the person did not have insurance. That person was uninsured.
So
those two
Malcolm, Tracy or Emmanuel, I don't want to just say who I think they should contact at Alliance first. Who would you guys recommend?
With regard to TCLI?
Yes.
Yeah, I can put that in the chat for Sharita and
Okay.
for people. So look forward to that, Sharita. I'm sending it right now.
Yeah, I think you really did nail into the answer in terms of this process being, once a provider and a client, a consumer virus enters into our catchment area, there's a logistical process for transfer to the to our catchment area. So it is a little bit, it's not necessarily in the housing part, but more on the UM side and compliance and network provider side of the house within Alliance. But that
Tracy, we just lost you.
Who's that?
I think we lost Tracy. She was speaking. But Sharita, I think if Manuel put the contact person in the group chat, I think that will give you the information, the person that you need to contact at Alliance to make sure that the transition occurs between that LME MCO and the receiving LME MCO, because that's what has to happen. But there are some steps that have to take place.
And Sharita, this is Malcolm. The thing that I would make sure to say too, I know this is not always easy to do with the person who's in front of you, but that's a process to be initiated by the outgoing MCO, by the TCLI team to the TCLI team supervisor. And those people all know each other. They're all on regular calls together. So it's a sort of the same department, different MCO pass through. So I would, we can definitely give you the information for who that person is at Alliance. it's probably more likely if the person that the consumer or the member that you have that you're talking to knows the staff person at any of the other MCOs where they came from, the initiating, like going back to that response is sort of initiates to that person saying, hey, contact us at, or you need to contact TCLI for this. And I do understand that that process does not always it's not just in your case, it's happened throughout the state, I think, where that pass through is tricky. The other thing I would say about the ISHP program that Stephanie covered too, but ISHP program, you still need to have a subsidy to pay for the operating costs in that situation. So that's where TCLI really comes in, just because it has the subsidy amount. So even with the person with an enhanced services, they need to have a housing provider that is that's paying for that, so or paying the rental subsidy.
Okay, friends, we are already at 11:31.
Yep.
I've written down several questions that Sharita put in the box in the chat. They're great questions, and I'll get those to you, Stephanie, probably early next week, and hopefully we can get answers out. Did you have any final comments you wish to make before we conclude?
Just really look at some of these the targeting program as an option. If you have like Malcolm mentioned, if you have a rental subsidy source, that is a great program to go into because most the properties have already gone through an inspection process, so you wouldn't have to have go through another type of inspection process. But if someone has a supportive housing, a COC, supportive housing voucher or subsidy, that is a path for them to take, and the program will actually pay, the state side of the program will pay their security deposit as well as the application.
Very good. All right.
Okay. And
Stephanie,
Lord, if you send me the questions, I'll answer those.
Yep, I'll be getting those to you. I really want to thank everybody for participating this morning. Hopefully, much of this information was helpful and great information to share. Really appreciate Stephanie's participation with us. By way of reminder, our next session in this monthly series will be on Friday, April 16th. So plan your schedules accordingly. Stephanie, we will be in touch with you. And want to thank Ruby again for being our technical support, Ruby Holmes in the Department of Community Development. Thanks, Ruby, for providing technical support for this effort. Really appreciate everybody's participation. Stephanie, thanks for the good work you're doing at the state of North Carolina. We'll look forward to continuing opportunities to stay in touch. Have a great day, everybody.
Thank you. Have a good weekend.
You too. Bye-bye, everybody.
Everybody.